Thank you everyone for joining us today. Today we'll be hosting our webinar, Statistics Canada RDC Alternatives, Doing Research Under COVID-19. The webinar has now begun, so if you are having technical difficulties with your audio, feel free to post it into the chat. If you have any other questions, of course, we do have a number of facilitators from Portage today who will be helping me out in the chat, so please post any questions that you might have there. Just a couple of housekeeping items. You may have noticed that you'll be muted automatically when you enter the room. When it comes to the Q&A session at the end of the webinar, you will be given the ability to unmute yourself. This is just for audio quality during the presentation, so you can feel free at the end to save your questions for that point. This webinar is being recorded and the chat may be archived for those who are unable to attend. We encourage everyone to use the latest version of Zoom so that you have access to all of the features. We do encourage you to use the chat feature if you are having technical difficulties or if you have additional resources to share. We encourage everyone to use the Q&A option to ask questions of the presenters. So you'll notice the Q&A button in your Zoom application. It'll offer you the opportunity to ask questions there. You can, of course, post questions in the chat as well if that's more convenient. And you may also raise your hands at the end. And at that point, if you would prefer to raise your hands and ask your question out loud, we'll hand over the speaking privilege to you. So we'll call on you when it is your turn to ask your question. Questions may be asked in English or French. A reminder that we do abide by the CARL Code of Conduct. You can find the complete Code of Conduct at the URL that will be posted into the chat. CARL is committed to providing a welcoming, safe, and harassment-free environment for its staff, membership committees, and working groups, as well as for participants, speakers, and organizers of CARL meetings and events. We do not tolerate harassment of any kind. Today, our presenters are Elizabeth Hill and Christy Thompson, both from Western University. Today, the presenters will discuss the differences between the data that can be accessed through the RTRA versus the RDC. RTRA data is a very useful option for some types of questions, but also has some important limitations. In addition, the presenters will highlight alternative sources of data from the US and elsewhere that are similar to the Statistics Canada master datasets. A little bit about our presenters today. Elizabeth Hill has been a data librarian at Western University since 1998. She has served as chair of the Statistics Canada's Professional Development Committee of the Data Liberation Initiative, DLI, and is currently a member of the DLI External Advisory Committee representing Ontario. She has also been a member of Portage Training Expert Subgroups, RDM 101 and Repositories 101. She has presented at iAssist on topics related to data access, data portals, and training. Christy Thompson has been the Research Data Management Librarian at Western University since 2019 and previously held positions as Data Librarian at the University of Windsor and as a Data Specialist at Princeton University. Her involvement with Portage includes participating on the Further Policy and User Experience Working Groups and the Dataverse North Policy Working Group. She co-edited the book Data Librarianship, the Academic Data Librarian in Theory and Practice for ACRL, and has published on topics ranging from international data sources to Aboriginal sports practices. I'm going to pass over the presentation now to Elizabeth and Christy.
Hi, thanks, Melanie. Can you hear me?
I can.
Okay, great. I'm Elizabeth Hill. I'm doing the first part of our presentation today. So first of all, Christy and I would like to welcome you to our session. We understand COVID-19 has created challenging situations for all of us in differing ways, and we hope your families are well. We'd also like to thank the Portage Secretariat for inviting us to give this webinar. Christy and I had initially presented this topic to researchers at Western, our home institution, as RDC researchers had reached out to us for alternative sources of Statistics Canada data. I know Melanie introduced us, and we do have the option of video today, so just a quick visual of us. But Christy and I are members of the Research and Scholarly Communication team within Western Libraries at Western University. If you're unfamiliar with Western University, we're in London, Ontario. The webinar today is directed at researchers who are needing access to data, but also to librarians and others. We're sharing with you alternative sources of data for research data center researchers, but the webinar also offers a refresher or new awareness of the continuum of data access model offered by Statistics Canada. I would point out that as this webinar has a national reach today, the individuals at your home institutions would likely be the people that you'd reach out to for additional support after the webinar. These might be data specialists or data librarians found within your academic library. All that said, if following the session you'd like guidance on how to determine your next steps, please feel free to reach out to either Christy or I. Our contact information will be on the final slide. This is a quick overview of the topics I'm going to address during my presentation. I'm going to give an overview of access levels to Statistics Canada data. I'm going to describe what type of access is available at academic institutions. And I'm going to talk about the continuum of data access model. During the presentation, I'll showcase a few links and also some screen captures that will inform you of how you might download data. I'll also spend a bit of time describing elements of the real-time remote access or RTRA program. Oops, sorry, I seem to have something on my screen there. If you are an RDC researcher who wishes to access RTRA, you'll be able to do that directly through your RDC contact. So
Hi, Elizabeth. Sorry to interrupt. I'm just wondering if you could reshare your screen?
Oh, did it go away? Something popped up a second ago. Can you see it now?
No, I can't.
Okay. Let me go back into Zoom. Yeah, a connection thing popped up, and I think that might have dropped it. How about now?
Perfect. That looks like it's going now. There we go. Wonderful.
Back to the slideshow. Okay, at a very high level, this screen shows the range of access to Statistics Canada data from the open to the more restricted access points. When I say open, if you go to the StatCan website, you can find tables that are under the open license agreement. The Data Liberation Initiative, which I'll expand on in upcoming screens, is an academic licensing model, and much of the content available through DLI can be downloaded from the Odesi system or the StatCan Nesstar. I'm talking in particular about the public use microdata files. Beyond that, getting to more restricted modes of access is the real-time remote access system and the research data center. I've noted here that due to campuses being closed because of COVID-19, RDCs are also closed. The Continuum of Data Access model helps users identify the various levels of data access at StatCan, of which the DLI is one avenue. The model uses costs, the conditions attached to the terms of use, and the content of the statistical information as it applies to the various dissemination channels. Products including pumps, although we think of them as being part of the DLI, are part of the open data license now. But in terms of access to the academic community, the Odesi system and the Nesstar, the StatCan and Nesstar system are the places where you would download these products, and I will speak to that. This diagram offers a visual of how to move through the continuum of microdata access from the DLI, providing access to pumps, the real-time remote access system, and RDCs. Public use microdata files contain anonymized, non-aggregated data. Using statistical software, the end user can group and manipulate data variables in these files to suit data and research requirements. I'm going to talk about the DLI. The Data Liberation Initiative, or the DLI, is a partnership between post-secondary institutions and Statistics Canada for improving access to Canadian data resources. The DLI provides support related to the use of the products at academic institutions, and a big element of the partnership is training, services, and support provided by StatCan. The goal of the DLI is to promote data and statistical literacy. The DLI is a subscription-based model that most post-secondary institutions subscribe to, including most universities and many colleges across Canada. An important local contact for you at your home institution is your DLI contact. I've provided a link at the bottom of this slide where you could look up the list of DLI members and determine who your local contact would be. Just highlighting once more the categories within the continuum, from unrestricted access to microdata on campuses that are DLI members. That would be a point and click delivery model through Odesi or Nesstar at StatCan. The RTRA program, which offers access to restricted microdata, as well as the RDC programs, which at the moment, their physical locations are closed. I mentioned Odesi a couple of times. I'm just going to describe it to you. It is a web-based data exploration, extraction, and analysis tool. It's the product of a partnership between university libraries, business, and government, which has improved access to statistical data for researchers, teachers, and students. Odesi can serve as a benefit to experienced and beginning researchers, provides experienced researchers the ability to search immediately across hundreds of data sets and collections, allowing for faster and more meaningful data reviews. Subscribers to the Odesi system include Ontario universities, some colleges, as well as universities that have, and other institutions that have subscribed from outside of Ontario. In this next screen, I've provided just a screen capture of how you might explore and search for microdata. If you wanted, in this example, to explore the data by topic or survey found within Odesi, you could browse and explore the topics, and then expand out to the survey and view which surveys have produced pumps that are available to be downloaded. In terms of pumps, the steps in anonymization include the removal of all personal identification information, for example, names and addresses. It would include only gross levels of geography, collapse detail information into a smaller number of general categories, for example, income and age, and suppress the values of a variable. In the case of some surveys, there will be suppressed variables. This may be a case where the researcher would opt to work with the master file. The data within Odesi is housed within a Nesstar server, a platform for exploration and downloading of data. In this screen capture, you can see that the metadata, or the information about the file, can be explored through the viewer. By expanding out the variable description tab within the interface, a researcher can assess if the variable level data would answer their research question. Expanding out variable level information permits a user to examine the weighted and non-weighted responses within the public file. Building familiarity with the pumps is an important step towards determining if a researcher still needs access to the master data file, either through the RTRA or RDC program. My next screen shows a screen capture of Nesstar at Statistics Canada. This interface permits subscribing organizations, that is DLI members, direct download access to the pumps, as well as the microdata for RDCs. What I mean by the microdata is the descriptive information about the files. You can't download the data directly through Nesstar because it's confidential data. Unlike Odesi, where you can explore and find tables and other products, this interface allows you to directly view the pumps. You can also obviously view and download the pumps from Odesi, but Nesstar at StatCan is housing the pumps. I've expanded out the file director here under the pump collection, and you can see the survey years available for, in this example, the absence from work survey. As the Odesi system and the StatCan web view both are built on the Nesstar Data Explorer platform, how you can view information about the data is identical. Here you can see the summary information for the variable that asks if the respondent left a job or was absent from work in 1998. When using Nesstar, whether in Odesi or through StatCan, the data can be downloaded by selecting the disk file, the floppy disk icon. Data extractions can be made in a file format ready for use in your choice of statistical software. I'm now going to share some information about the real-time remote access system. I just want to acknowledge that StatCan employees working on the RTRA program, as well as our counterparts at the University of Ottawa, have made several presentations on this topic and were generous enough to share their slides with us, which helped inform this presentation. Real-time remote access is a subscription-based licensed access point for Statistics Canada data. It permits access to master data held at Statistics Canada based on remote job submission. Because the researcher is not directly interacting with the data, the same process of applying for use of the program, in this case I'm referring to the RDC, does not apply. RTRA allows for remote submission of SAS code in order to produce tables based on microdata. The output is vetted by the RTRA system and provided to the researcher. A notable benefit with respect to the output from RTRA is that the tables returned from the job submissions can be publicly shared. So I've noted here on the slide that a number of Canadian institutions are RTRA members. But during this time of COVID, the Canadian Research Data Center Network has provided additional access to the RTRA system for current RDC researchers. If you are an RDC researcher in this category, you would gain access to RTRA through your RDC contact. How do you know that the RTRA is an appropriate avenue of access for you? Well, some of the answers to that would be when complex modeling is not required, when the pump lacks the required detail or the project does not fit the requirements of the RDC, or it might be the case that it could provide access to a data set that does not have a pump. How does real-time remote access work? It can be accessed from any computer with internet access using a secure username and password. Submissions are made in the form of SAS programs using an EFT, an electronic file transfer site, and confidentiality is automated. The visual on the right depicts how the user does not have to be in the same physical location as a server with the master file data on it, but is interacting with the master file through a remote submission process. Real-time remote access provides fast access to a pool of data sets. The deemed employee status is not required, and if you're not familiar with the RDC program, that is a requirement of becoming an RDC researcher. You have to become a deemed employee of StatCan. RTRA provides access to data sets that aren't restricted to approved projects. This similarly is a comparison to the RDC program, where you could be approved to work in the RDC, but only on the project, only on a data set that fits with your project. The vetting of outputs is fully automated by the system. You can access the system at any time through the internet while you have an approved account. And a full range of descriptive statistics are available through RTRA. Other points I'd like to highlight is you can have rapid access to the system. The documentation and dummy data is available to you when you have an active RTRA account. And when you submit a job against the RTRA system, you can have the results within an hour. It can expand research data options and access data at all points in the research lifecycle. It can be useful for data users that have some statistical knowledge, but maybe not heavy end users. And it can be an experience where a user could build some statistical analysis skills through using the RTRA system. However, a basic level of statistical analysis experience is required to use the system. There is a fair bit of support provided by StatCan. However, it'd be useful to have some statistical knowledge before using the system. I pulled some additional notes from the RTRA user guide that you might find useful. The SAS program has to be written in a standard format in order to automate the confidentiality process within RTRA. In that sense, there's a defined number of SAS commands that can be used. The frequencies around it, this is explained within the user guide. Some variables are renamed and others are deleted if disclosure risk is an issue. And 3 types of statistics are calculated within the RTRA. Basic statistics including frequency, mean, percentiles, percent distribution, proportions, ratio, and share. Higher order statistics. These statistics calculate differences between the basic statistics available in the RTRA system and sequential overtime statistics, which compare the value of every cell with the value of the cell directly below it in the table in a sequential manner over time. Over 200 survey cycles are available, and a few that are of note are noted here. The Canadian Survey on Disability, the Post-Secondary Student Information System. And this screen highlights that there are a number of data sets that are not available as public microdata that are in the RTRA system. These might be of particular interest to some users. I'll leave you a moment to look at the screen. And there's some administrative data that's available in the RTRA system, the Uniform Crime Reporting Survey, the Canadian Cancer Registry, and homicide data, to name a few. General disclosure rules and controls are applied to all outputs. One thing that's important to note is the smallest level of geography that can be returned as a result of an RTRA submission is provincial. Only weighted data are released. All logs are scanned and modified for protection. And the maximum number of successful submissions per day is 10. Now, you could submit more than 10 jobs, but if you have a syntax error, that would count as a rejected submission. So if you, in one day, manage to have 10 successful job launches with no errors, you could, per request, have a yield of up to 10 tables per job, giving you possibly up to 100 tables per day. The RTRA system applies additive and controlled rounding to all frequencies. The rounding base is survey driven, and that can be found within the documentation. So some of the benefits of using RTRA include the fact that once you have an active account, you can have access anytime. There's few conditions on the access and use of the data. Full master files are available. And the deemed employee status that's required for the RDC program is not required for RTRA. And as I just mentioned on the previous slide, you could possibly get up to 100 successful table outputs per day. There are lots of available program examples in the RTRA documentation. And using RTRA in usual circumstances when campuses are open can be a useful tool in enhancing an RDC application. And what I mean by that is if you determine that a pump or the pump collection in general can answer your research question, and you need to see if there's some stats in the master file that you would need for your research, and the master files in RTRA and the RDC. Doing some work with the file using the RTRA system might enhance your RDC application. Okay, some of the limitations of using RTRA. One is that the job submissions have to be made in SAS. StatCan is working on a graphical user interface for the RTRA system, but it's not live yet. So down the road, this will change. Only certain statistics are available. These are descriptive statistics. The outputs from the job submissions are tables, and not all data sets are available. There also is a fair time investment required to understand the data set and the documentation, as well as SAS programming language in advance of running your RTRA job submissions. Just a reminder from an earlier slide, the available descriptive statistics included in RTRA are frequency, mean, percentiles, percent distribution proportions, ratio, and share. How can you access RTRA? If you're currently an RDC researcher, you can ask for access through the RDC program using the contact at your campus. If you are a non-RDC researcher and you're at an academic institution, contact your local data liberation initiative. I'm also providing the direct email here for the RTRA program folks. Additionally, Christy or I can provide additional information after the session. Just going to very briefly talk about the Research Data Center program, as it is part of the Continuum of Data Access model. Some of you may be RDC researchers, or you may be working in the academic libraries and are aware of the Research Data Center program. But the Research Data Centers promote and facilitate research that uses the Statistics Canada microdata files at 32 universities across the country, as well as 3 federal research data centers located in the National Capital Region. As I mentioned earlier, researchers within the RDC become deemed employees of StatCan. Similar to the RTRA program, when you're working with data within the RDC, you are interacting with the master data files. I've also included a link on the screen to the StatCan webpage about research data centers. I think that's my last slide. So thank you for listening. And then Christy is going to do her presentation, and then we'll take Q&A afterwards. Thank you very much.
Okay. Hi. Hope everyone can hear me now. This is Christy Thompson. I'm going to be talking about using data from other countries to substitute for or supplement what we can get from Statistics Canada. As a colleague of mine pointed out at one point, this is a bit of a sad irony because the original goal of the Data Liberation Initiative, the Research Data Center Network, and so on, was to break the reliance of Canadians on having to use data from other countries these are unfortunate times, and hopefully that will end soon and we can all go back to using the RDC. I'll be primarily focusing on US data with the occasional mention of the United Kingdom, since these are the countries most frequently used to substitute for Canada. But please keep in mind that many countries conduct similar surveys. This is not a complete listing of everything out there, just a selection of sources I found most helpful for looking at specific topics. There are a few reasons why using data from other countries to supplement or replace Statistics Canada data can work surprisingly well. For one thing, government data collection tends to be done for specific policy reasons that many countries have in common. Most countries will have a census, a major employment survey, some sort of consumption survey, a few health surveys, and so on. So it's often not difficult to find a fairly close equivalent to a Canadian government survey that has a similar cluster of questions. Also, US data can be a better replacement for RDC files than Canadian public use files or real-time remote access files, because US public use data is often released at a level of detail close to that which in Canada is only accessible in the RDC. The US just doesn't do as much suppression and generalization to anonymize their data, so you can run your very detailed regressions and so on and use the full variable list. Data from the UK is often also quite detailed, though I don't recall being surprised by the level of detail quite as much as I occasionally am with US data. One major difference in data collection between the United States and countries like Canada and the UK, and practically every other country out there, that can make finding things difficult is that the US has no national statistical organization. Government surveys are conducted by whichever department feels a need for the data, which could be the Census Bureau, the Federal Reserve, the Bureau of Labor Statistics, the Center for Health Statistics, or one of about half a dozen others. This leads to some duplication, particularly in the area of economic surveys. Since there is no organization with a general just collect statistics mandate, other areas fall through the cracks. As a result, some of the major US surveys are done by universities or other organizations. For example, the United States version of the General Social Survey. Using American data in place of Canadian is obviously problematic for anything that looks at health system factors and health outcomes due to the differences in health insurance. The United Kingdom, like Canada, does have a national health insurance system, but the systems are not identical. I would say that overall, Canada and the US are closer demographically and economically than Canada and the United Kingdom, but there are clear differences and some exceptions. Again, see the health system. In general, relationships among social and health factors are generally considered to be comparable in different countries at similar levels of economic development, with some caveats. Things like prevalence estimates I would be far more cautious with. If you are looking for a replacement for a government survey, again, keep in mind that governments have similar data collection needs, so the best equivalent is often another government survey. Failing that, it's often a good idea to look for something from a major think tank or university-based research organization, something that's likely to have the scale of coverage and scope that you're looking for. It can be tempting to start your search with a general survey archive, such as ICPSR, but this is often not my first approach for two reasons. One, you'll miss a lot of data, including some important government data that you could have gone directly to. And two, results will be dominated by smaller specialized surveys that may not have the scope you need and will be distracting. A last note before I get into the sources. I'm going to be throwing an incredible number of links at you, so I will mention that these slides are going to be made available by Portage. They usually get them up within a few days. Also, another side effect of US decentralization is that some of the US data can be accessed in multiple ways, either from the original government department website, through an online access tool set up by a university organization or data archive, or occasionally from a different governmental department site. For each survey, I've tried to link to the source that in my experience is likely to have the most complete coverage in a format that's reasonably easy to use, which is not always the originating source. All the United Kingdom links go to the UK Data Archive because they're sensible like that. I'm going to start with the economic and labor surveys, alternatives to the labor force survey, the Canadian income survey, the survey of household spending, and so on. The big employment and income survey in the US is the current population survey, which is carried out by the Census Bureau, not the Bureau of Labor Statistics. This is a pretty big and detailed survey. In addition to the base survey, which is done on a monthly basis, like Canada's labor force survey, the CPS has various supplements collected in different months. March is always demographic month, and other monthly topics include or have included immigration, fertility, school enrollment, volunteering, veterans, health benefits, and various other random topics. The National Bureau of Economic Research has a handy chart showing which topics have been covered in which month over which time period. So I'll be coming back to this current population survey again later because it can be used to supplement for other data sources as well. For income surveys, the Survey of Consumer Finances is conducted every 3 years by the Federal Reserve and covers the income, assets, liabilities, and other financial characteristics of households. It contains an oversample of wealthy households, which gives you some idea of the focus of some of the other questions in there. The Survey of Income and Program Participation from the Census Bureau surveys the general population and also includes assets, but focuses on assets that affect eligibility for income assistance programs. And the panel study of income dynamics, a very long-running study from the University of Michigan, is similar but has an oversample of low-income households. And finally, the National Survey of Unbanked and Underbanked Households looks at the most financially unstable households. It's from the Federal Deposit Insurance Corporation and is currently conducted as one of the supplements to the current population survey. So if you're interested in income or other economic household data, you can choose your survey based on which end of the income distribution you are looking at. For the United Kingdom, I will just mention their labor force survey, which is available for download as both longitudinal and cross-sectional data. Moving on to surveys of consumers and household expenditures. The Consumer Expenditure Survey from the Bureau of Labor Statistics is probably the most comparable to Canada's survey of household spending. The Food Expenditure Supplement to the current population survey is similar to Canada's discontinued Family Food Expenditure Survey. In addition, the Department of Agriculture and Food does an acquisition and purchase survey looking primarily at food expenditures, including food eaten at home, eating out, and a detailed consumption diary to monitor the eating habits of the household, somewhat similar to the Canadian Community Health Survey's nutrition module. So this is both a food expenditure survey and a nutrition survey. The US also has a number of more specialized expenditure surveys, such as the Medical Expenditure Panel Survey. The next two I want to highlight are a bit different. I wanted to mention the Survey of Consumer Expectations from the New York Federal Reserve Board. Canada also has a survey of consumer expectations that looks at many of the same things and is done by the Bank of Canada. But as far as I can tell, the microdata has never been made available anywhere. The microdata from the New York Fed is made available in massive Excel files. In addition to asking about consumer expectations, it covers employment status and a few other household variables. So it can be useful to supplement other income and labor surveys. However, most questions focus on economic expectations, both personal prospects and expectations about the country as a whole. It's available since 2013. I will contrast the similar sounding University of Michigan Survey of Consumers. These consumer surveys are totally not consumption surveys. They are shorter monthly surveys that have been done since 1991, focusing more on expectations for the economy in general and less on personal experience. So don't be fooled by the title. For the UK, I just wanted to highlight the Living Costs and Food Survey, which does pretty much what it says it does, household and food expenditures. It replaces the Family Expenditure Survey and National Food Survey. In one form or another, this survey has been conducted since 1957. So if you want a longer time series consumption survey, this is a good option to consider. Next up, we have health surveys, alternatives for the Canadian Community Health Survey, the addiction surveys, and others. Several surveys are conducted by the Center for Disease Control's National Center for Health Statistics that have some overlap with different modules of the Canadian Community Health Survey. The National Health Interview Survey is probably the most similar to the Canadian Community Health Survey overall and is the most general. It includes modules on alcohol use and physical activity and has pretty good coverage of mental health. The National Health and Nutrition Examination Survey, similar to the Agriculture Survey I mentioned earlier, has similar data to the CCHS nutrition modules and also partially overlaps the Canadian Health Measures Survey. It includes direct measurements done by nurses. I also like to point out the UCLA's California Health Interview Survey, which is a useful source with some questions but aren't in the others. It is not the only state-level health survey, but I'm flagging it here as I recently used it for a CCHS replacement question that none of my other usual sources was working for. The United Kingdom has several health surveys. I'll just mention here the Health Survey for England, which combines questionnaires with physical measurements and the analysis of blood samples. It's sort of a combination of the Canadian Community Health Survey and the Canadian Health Measures Survey. Canada's addiction surveys keep getting renamed, but I think the most current is the Canadian Tobacco, Alcohol, and Drugs Survey. The major general addiction survey system in the US is the Behavioral Risk Factor Surveillance System, and the young adult version, the Youth Risk Factor Behavioral Surveillance System, both done by the CDC. In addition to substance abuse, these surveys cover other behavioral factors such as preventative measures and have some questions on chronic conditions and health. So they're almost more general health surveys with a really, really strong set of addiction-related questions. The same department also does the National Adult and Youth Tobacco Surveys, which are quite similar to Canada's smoking surveys. I'll also point out Monitoring the Future, a high school cross-sectional that focuses on drug use, done by a group of researchers with funding from the National Institute of Health. Also worth a look is the National Survey on Drug Use and Health and other data from the Substance Abuse and Mental Health Archive at ICPSR. These can be a bit redundant, though they aren't identical. The US seems to operate here on the principle that if one addiction survey is good, then a whole bunch of addiction surveys must be really good. Of possible interest, going back to Canada for a moment, a public use file for a 2009 Health Canada survey of young adult drug use was recently loaded into Odesi, and a few more are queued to be added sometime later this year. A few others. The US doesn't really have a good major health survey on disability similar to Canada's Survey on Disability or Participation and Activity Limitation Survey or so on. The thing seems to get renamed every time we do it. They do have a National Health Interview Survey on Disability that was done once as a module for the National Health Interview Survey, but it was last conducted in 1994. Currently, the Center for Disease Control suggests using the limited set of disability questions in the American Community Survey to estimate disability prevalence. And I also wanted to point out the Listening to Mothers Survey, which has questions in common with Canada's Maternity Experiences Survey and has been conducted intermittently between 2002 and 2018. Most instances of this survey have national coverage, but 2018 was only done in California. I don't know why. Next up is equivalence to the Canadian General Social Survey, or near equivalence, vaguely near equivalence. The Canadian General Social Survey gathers data on social trends to provide information on specific social policy issues. This is a pretty broad mandate, which is why topic areas have been split off into modules conducted in different years. Obviously, the first thing I will mention is the US General Social Survey. Now, I love this thing, but it's one of those many-headed monsters and has covered a bewildering variety of topics in its long lifetime. It does have a core of questions taken from the International Social Survey Program that are basically in common with some core variables of the Canadian General Social Survey. Additional questions get added through regular calls for proposals, which means that they've asked about all sorts of randomish things at different times with no real consistency. Some things get repeated, others don't. So I wouldn't necessarily expect the US General Social Survey to be a good match for something specific you've been looking at using the Canadian General Social Survey. But that's okay because there are other options. For example, the World Values Survey, particularly since some cycles actually include Canada. However, as the name suggests, these focus more on cross-cultural comparison of norms and values, more looking at belief systems than social behaviors. So there's less overlap than you might expect. A better bet might actually be some of the surveys conducted by the independent US think tank, the Pew Center for People in the Press, particularly their social trends surveys. You might also want to look at the American National Election Study, which covers some social topics quite well, definitely more than the Canadian Election Study does. For specific modules of the Canadian General Social Survey, the closest equivalent to our time use survey module is the American Time Use Survey from the Bureau of Labor Statistics. The American National Crime Victimization Survey is reasonably comparable to the GSS victimization modules, and the Current Population Survey Supplement on Civic Engagement has some content in common with the Canadian General Social Survey Giving, Volunteering, and Participating module. For this topic, you might also consider looking at the civic participation questions which show up in the American National Election Study. Moving to United Kingdom, the British Social Attitudes Survey is probably your best bet, but as a starting point, but it has more of a political focus and is in some ways closer to the election studies than the General Social Survey. Lastly, I'm going to look at longitudinal surveys, studies that follow people over time. Longitudinal survey data is not a place where Canada has a huge number of options available, though there are some. In addition, we don't currently release public use files that can be analyzed longitudinally, but other countries do. Canada's National Longitudinal Survey of Children and Youth, though becoming dated, is still the Canadian longitudinal survey that I get the most questions about. It covers children who are age 0 to 11 at the study's beginning in 1994 and has followed them ever since. A key factor to consider when looking at alternative data sources is what age range you need, as many of the US surveys start with respondents who are already in high school. I will start with some longitudinal data from the Bureau of Labor Statistics, the National Longitudinal Surveys of Youth, 1979 and 1997. These two are very long-running and very detailed surveys. The 1979 Youth Survey has a fascinating add-on looking at the children of the woman in the original 1979 cohort that could also be used as a substitute for looking at respondents who are younger than those in the National Longitudinal Survey themselves. I don't think there's another survey out there that allows such a detailed and long-running generational analysis. However, I will point out that the NLSCY is strongly focused on labor market outcomes, whereas the Canadian NLSCY covers social and health topics as well. If you have education-focused research questions or are interested in looking at younger respondents, studies from the National Center for Education Statistics may be a better option. Consider, for example, the early childhood longitudinal studies, as well as the secondary longitudinal studies program. You might also consider the National Longitudinal Study of Adolescent to Adult Health from the University of North Carolina, particularly if instead of looking at education or labor market outcomes, you're interested in research into physical or mental health or social networks of adolescents as they grow into adulthood. I also have to mention another of my favorite surveys. The Wisconsin Longitudinal Survey is another survey following adolescents into adulthood and has unique features including psychological and personality testing, sibling data, and genetic data. It's a bit like the US General Social Surveys. All sorts of random things seem to have been thrown in more or less on a whim. If other sources aren't working and the age of participants isn't a barrier, given that this thing started in 1957, you might want to have a look. It's the longest running of the major American longitudinal surveys. The United Kingdom Data Service houses a number of longitudinal surveys as well. If you're looking to replace the Canadian NLSCY, I would start by looking at either the Millennium Cohort Study, looking at children born in the year 2000, or possibly the Child Development Study. The US government doesn't seem to have any longitudinal studies specifically of immigrants, so I can't really recommend a great replacement for Canada's longitudinal immigrant survey. They don't actually have much data on immigrants at all beyond what's picked up in the general surveys. However, Princeton University's population research group conducts some immigration-focused longitudinal studies. The new immigrant study is the closest equivalent I've found to Canada's longitudinal survey of immigrants. Others from the same source include the highly skilled and educated immigrants and the Children of Immigrants longitudinal study. The current population survey did have an international migration supplement done one time in 2008, but it's a cross-section, not a longitudinal survey. Also note the UK's longitudinal study of immigrants' children. They again don't have the greatest selection of data on immigrants. This is one area where Canada has one really good survey that I can't find a perfect equivalent for. Although our national graduate survey no longer seems to have the follow-up component that gave it some longitudinal analysis capability, I wanted to toss a couple of graduate surveys in here. Baccalaureate and Beyond Longitudinal Study is the closest equivalent to our national graduate survey that I found. And Princeton's National Longitudinal Study of Freshmen may also be of interest for some topics. It looks specifically at minority achievement. My last couple of slides are just a small collection of links to some of the most important starting points for tracking down US and international data sources. I won't describe them here because I've already shown you many surveys linking back to all of them. I just wanted to gather them together for reference. I hope everyone has found this interesting, if not useful. Are there any further questions for either Liz or me? If you don't feel comfortable asking them here, you could also email us later and we'll try to follow up with you.
Thank you so much. We do have a number of questions in the Q&A. We're really lucky to have Grant from the Canadian Research Data Center Network also on the call today, and he's actually been answering a lot of the questions that have been coming in through the Q&A, so that's really great. I did want to let everyone know that we'll take all of the answered Q&A questions as well as all of the open ones and provide answers to as many of those in a document when we send out the presentation. I'll work with Christy and Elizabeth to make sure that we can send out as many of those answers as possible. If you have questions, just because the chat, I don't want anybody's question to get buried there, please use the Q&A feature. If you do have a question for Elizabeth or Christy, I am going to also open up the ability for participants to unmute themselves. So if you do have something to contribute, please, you will be able to do that in just a moment here. So I'm going to just go over to our Q&A and see if we can go into any of the questions that are still open that haven't been answered yet. So the first question from William, is anyone discussing of moving to a more liberated US model?
You mean for access to Canadian data?
Yes.
Mm-hmm. Oh, I think that's something that people are always curious about. Much of the data that had been part of DLI is under the open data license now, so that's been a really big improvement. And StatCan is working towards making the public use microdata file available for anybody to download. Right now, the ease of access is found more through the academic institutions.
If you're specifically asking about access to the research data center as an American, it's sometimes possible to arrange for a Canadian collaborator to work with you, but that's the only way I know of for a US researcher to get access to research data center data.
Good point.
Thank you. Let's see what we have next. When will the CCHS data in the RTRA be updated?
I don't know that, but they do have, StatCan monitors a list for RTRA, so questions like that can be posed directly to StatCan. I'm not aware of the timeline for the release of different surveys. We could pose that question on behalf of the user, or the user can pose it themselves.
Thank you. Are there any options or interfaces for researchers that are working with pilot data, such as UCASS, UCAS?
I don't know that there are any. If something isn't available through the RDC or through the Real-Time Remote Access Program, RTRA, then your best bet is to email the department that put out the data set that you're looking at and see if custom tabulations are available. But if anyone else knows more than I do about that, then please jump in.
Does anyone else have anything to contribute to this? If you do have the ability to unmute yourself. So moving on to the next question, are the current COVID surveys being run by StatsCan going to possibly be available to researchers either by the RTRA or other avenues over the next few months?
Well, there's definitely summary data available at StatCan, and I feel like Christy and I were talking about this recently, that is there some discussion about a pump, Christy?
I believe there was some discussion of a pump on the DLI list, but I don't remember exactly what they said. So if you want a definitive answer, we'll have to get back to you or ask if some contact the DLI directly.
Can panel data be downloaded?
I wonder if they mean through the RTRA, or do you mean as a pump?
Whoever asked that, could you clarify what you mean by panel data?
Mustafa, are you on the call? Would you like to clarify your question?
If you mean panel data as in longitudinal data, then there are no panel data sets in Canada that can be downloaded, which is why I've been highlighting international alternatives.
And another question, is the 2016 census excluded from the RTRA database?
I'm not sure of that offhand. I saw that question, and I don't know if it's just a timing thing that they haven't released it yet, or I mean, basically what you have to go by is the surveys they have on the list, but you can always send a note, or we can send a note to the list asking if there's plans to add that.
Yeah, you would think it would make sense for them to have that one, but there might be issues that are making it difficult.
Yeah, it may just be the time it takes to get it prepared for the system. So I don't know off the top of my head, but we could explore that further.
Yeah.
And this question is for Christy. Christy, do you have notes on the characteristics of these surveys? People are really interested in sort of the comments that you made. If you'd be willing in distributing maybe your talking and notes that you've made on the characteristics of these surveys.
You may, if you want a copy of what I was just my slide notes as you heard them here, you can contact me directly and I'll send them. If you have a specific survey that you want my personal observations on, I guess you're welcome to ask that. I don't have a directory of all the information on these surveys, but I've worked with a number of them because I used to do data analysis, so I have opinions on them.
Thank you very much, Christy. Can I just pop in and say one thing, Melanie? I did answer a few of the Q&A things while Christy was talking, but there seems to be a bit of a theme about if you're not an RDC researcher, can you use the RTRA? So some of the universities have a subscription, and I had reached out to StatCan last week anticipating that people might ask this question. So anybody who would like to try RTRA should send a note to that RTRA email address or to their local DLI contact. But StatCan is willing to let people trial it even if they haven't, if they're not at a subscriber institution at the moment.
Thank you for that clarification.
And I know a couple of people have asked about when the RDCs will be reopened, but that's not something we have any more insight to than anybody else because it's tied to the physical locations of campuses, and then StatCan would have some say on what happens with their facilities when it's time to reopen campuses and facilities. I believe if you're a current RDC researcher, you'd probably be getting some communication from your RDC contacts as well.
We did get a clarification from Mustafa. By panel data, he was they were referring to the survey of labor and income dynamics.
Actually, I believe that there was a panel data file released for that was something like back in the late 90s that you might have been able to get to a couple of years that you could analyze in a panel data way. I don't remember exactly, but contact me directly and I can look into it.
It is on the list of surveys for RTRA, but I think the question was more whether you could download the data.
Yeah.
Yeah.
I think there were a couple of years where you could actually download that data.
Okay.
At some point. But I wouldn't swear to it because there are a lot of surveys.
Mm-hmm. And there were questions as well about whether you can run regressions in RTRA, and you can't. It is just those basic statistics.
And there were several questions about whether RTRA was planning to add the ability to use other statistical packages. And my awareness is that they are not. Instead, they are focusing on developing a graphical interface that will make it easier to use the SAS interface.
Yeah, I think even the GUI is based on a backend SAS program, so they really can't move away from that. Yeah, and someone asked whether you can paste lines of code from a program to SAS, and I think you can, because you can borrow libraries of code from other users of RTRA, and you're going to be working on or accessing the system from your own desktop, so that would be possible. Someone has asked for a link to the DLI contact. I think I can pop that into the chat.
Somebody asked, can you suggest resources available to help check the anonymization process or results of a large survey data set that we hope to make open access? There's actually a Portage working group that's currently developing a guide to that effect, but it's not available yet, but we hope to be releasing it within, I don't know, probably a couple of months.
And another question, I'm not sure if we've already covered this a little bit, but if an RDC approved researcher wants to add a student or research employee who is not RDC approved to their project, how would that work?
Statistics Canada, I think, has a standard process for doing that, and would just go through the standard process. I've been added to a few surveys actually to assist researchers in the RDC, and it's under normal times, it's not something that would take a great deal of time. At the moment, RDC stuff is working a little more slowly than usual because some of the staff members have been pulled away to work on other things.
Another question to clarify, RTRA only available to current RDC researchers or the broader community looking for clarity?
As Liz said, if you contact them directly, they're considering allowing trial access to people beyond the current roster of researchers due to the unusual circumstances.
Yeah, they are open to allowing institutions who aren't members to have access to one or two accounts. And people tend, like at Western, we only have a 2-user subscription. And we found most times that only 1 or 2 people at a time are interested in using it. And it's usually for a short time. They're looking to explore a survey or two and to see if it's going to answer their question. And within a couple of weeks, they're not using the account anymore.
So just recognizing that we are past time now, if there are any other questions that you have, please feel free to add them to the Q&A. I believe that we've answered the majority of them. If we have missed yours, please feel free to flag that and we will return to it.
Yeah, and I think there definitely is a curiosity and interest in RTRA as well as the cost associated with it. And StatCan is aware of that. And I think they have presented at DLI training about the model of having it linked more closely with the pricing of DLI. So that might be something that would be coming down in upcoming years.
A question from Yara. So the NLSCY data set is still not available remotely. And they can't really run regressions using RTRA.
That is correct. Three of the earlier, the 3 earliest cycles of the NLSCY is available through the Data Liberation Initiative, but cannot be analyzed longitudinally. All of the later cycles are restricted and can only be accessed through the RDC or perhaps RTRA. I don't remember if they're
I'm on the RTRA page. No, I don't see them on the list of surveys. I was just looking at them.
Yeah. And again, regressions cannot be run
through
RTRA.
I also saw there were some questions about the difference between the Nesstar service and the Odesi service, and maybe I wasn't as clear as I could be. Either could be used to download the pumps. If you aren't a subscriber to Odesi, but you are at a DLI member institution, you'd be looking at downloading the pumps using the Nesstar, the StatCan Nesstar service. You can look at the metadata for everything through Odesi, but you wouldn't be able to download the pumps, but you could download any of the files that fall into the open category, like the tables and the opinion polls and the like. So that's one big differentiation. Of course, we're within Ontario, so I think we're used to being able to use Odesi, but that doesn't apply to everybody who's on the call today.
The thing that the Statistics Canada Nesstar has is the metadata for the master files that you cannot access through Odesi.
I think you can. I think you can find them in Odesi as well.
You can?
I believe so. I think I looked there last week. Be happy to have someone chime in to confirm that. I think I helped somebody find that on there. That's one of the more recent options, I believe.
But if you're looking, even for the ones that aren't available as public use files at all?
Yeah, I think you can look at master file codebooks through Odesi as well. Depends on the survey, it says, but yes, some of the metadata is accessible in Odesi. So yeah, if you want to look at the more complete list, somebody just popped that in, Grant. Thank you. So maybe the more complete metadata or the information about the master files can be found on Nesstar versus Odesi. Thanks for that.
Just a clarification question on access to master data from any cycle of CHMS through RTRA.
I was just looking at the list. Are they asking if any of that is available through RTRA?
Yeah, they're asking if they can have access to master data for any cycle of CHMS through RTRA.
It's not on the list, that survey. The Canadian Health Measures Survey, is that right?
Yes.
No, it's not on the list of RTRA surveys. I guess anyone on the call who ever has a question about is something going to be added, I mean, feel free to reach out to your DLI contact or email the RTRA folks yourself as well.
The question about adding a new researcher, will they need to do fingerprint and all of their steps? You won't need to do a complete application again, but the new researcher will need to go through fingerprinting and being sworn in and so on.
We did have a question earlier about if a student is halfway through their work, is it possible for the student to request the outputs now to be able to complete early analysis and then again, once allowed access back to the RDC?
I guess maybe I'm trying to understand that question. Do they mean, could they use RTRA for the table outputs, but then investigate the survey back in the RDC when it reopens? I think that would be totally valid if they're an RDC researcher, that's, as long as I guess they're able to get back on campus while they're still a student. Your thoughts, Christy? Or?
I was wondering if the question was something to do with they partially finished their analysis and they were hoping that the partial results could be sent through the approval process. And to the best of my knowledge, that would not be possible because the Research Data Center network has no access to the stuff on the computers in the RDCs at the moment.
Okay, I see what you mean. Yeah, it could be either of those, I guess. Maybe the person who asked the question could clarify that.
Unfortunately, it was an anonymous question, but if they are still on the call, they're welcome to chime in.
When we presented this at Western, some similar type of challenges were raised for grad students who had some of their work done ongoing in the RDC. And just given timelines, I think it was a more pressing concern for some of them whether the analysis they could do using RTRA would help them finish their project if they were supposed to finish this year. But I'm not, as Christy says, I don't know if I'm interpreting the question in the way it was intended.
So a question just came in. Is there any possible solutions for a student who is writing their thesis and needs something extra from the analysis?
With respect to RTRA in particular?
Kate, are you on the call? Do you want to elaborate on your question?
This possibly could be a time where maybe exploring the pump might be sufficient. I don't, it might be good to hear from, say.
Yeah, I need more detail to know what they mean by that.
Just a reminder, so we are over time now. If there's any last minute questions, we can always share those with our presenters, and we will be gathering all of the Q&A from today that have been answered, whether it's been in the chat or we'll bring all those questions together in a central place when we distribute the recording from today as well as the slides. So those will be distributed. I want to thank our presenters. Again, if any last minute questions, I will be sure to forward those to our presenters from today. But thank you all for attending. It was great to see so many people on the webinar today. So thank you very much and have a great day.
Thank you.
Yeah, thank you. And thank you, Melanie.
Yes, thanks, Melanie. Thanks, Portage. Oh, there was more clarification from Sade, and he's still on the call, or she. Analysis not yet completed, but few things to add only by new analysis. I'm still not clear what the platform.
Yeah, it depends. Is it on, are they using the RDC?
Did Sade be unmuted for a moment, Melanie?
I did unmute them, I thought. They're permitted to speak, so Said, you can unmute yourself.
Yes, are you hearing me?
Yes,
Yeah.
we are.
Yeah, thank you for the clarification. Just my question related to my analysis. It's a few things I need to do from the analysis. So it's possible to have any possible solution for that, just to be able to finish my thesis.
Is that in the research data center that you need to finish it?
Yes, Research Data Center, RDC, yes.
As far, I don't know of any solution that is available for that, except maybe trying to see if you can use a public use file to supplement your analysis.
Okay, thanks. Thank you.
Well,